We have quite a vast structure at Manchester Foundation Trust, which grows year on year. As you probably are aware, we've had North Manchester join us in April, which makes us even bigger than ever. One of the largest trusts in the country. So I'm going to be talking on behalf of the research and innovation managers who I line manage across the trust. There's 6 of them. And Jo's going to talk a little bit about how she supports the research and innovation managers at MFT with NIHR grants. So next slide. So if you don't know already about MFT, I'm sure most of you are aware of the size of it, but just as an introduction, it's just the size of the population we serve, and now with North, it's even more. We are the largest provider of specialist services in the UK. So lots of scope for seeking the right patients for innovative and translational research. Next slide. So the Trust has research and innovation right at the core of its vision. And obviously it's to improve health and quality of life. And we have a very diverse population, as you probably are already aware, across Manchester. And we want to build an organisation that excels in research and innovation and teaching, and also that we attract the right people and retain good people so that we can move forward with our research and innovation and become very well known as an internationally renowned healthcare provider. Next slide. So in research and innovation, we build that vision and ethos into how we work, and we do want to improve lives and give the opportunity to all patients in clinical studies and evaluation. And across each of the hospitals in our trust, there's 10 now. These are all the hospitals, if you're aware of them, across South Manchester, North Manchester and Central Manchester. And our research and innovation managers cover all those areas, the 6 of them. So they're spread quite thinly, even though most hospital trusts don't have so many research and innovation managers serving each of the hospitals. They usually just have a research office. So I think we're quite blessed in MFT that we have an infrastructure that enables us to reach out to those hospitals. Next slide. So this is basically the structure. We all report into a joint group medical director. So each of the hospitals have CEOs and medical directors, and then there's a joint group medical director. And our managing director for research innovation is Ian McLean. He reports directly into the joint group medical director. So it's really quite senior in the infrastructure of MFT. And alongside that, we have Rick Boddy, who is the group director. He reports into the group director of research and innovation as well. So the structure changed when Ian McLean took the helm as managing director, which was not that long ago, about a year ago now, a year and a half. And he's created all these heads of. So we have a head of innovation, a head of research office, research delivery and nursing. And the research and innovation managers fall under the research delivery arm of the infrastructure. And I report into the head of research delivery, Claire Cole. And the research and innovation managers all have clinical trials managers and coordinators under them right across the trust. There's about 500 to 600 staff that work in research and innovation across the trust. So it's not, it's quite an undertaking to work in terms of systems and processes and who to talk to. Also, I'm going to just introduce very quickly the innovation team. Only because some of the work and the aims of R&I will incorporate the innovation team, which I'll introduce in a second. Next slide. So the main priorities for R&I for MFT are generating clinical research capacity and new trial opportunities, which very much falls under the research delivery work streams. and also recognising strength in diagnostics and how to integrate them. And I think that falls under our innovation team more so, with the DETA initiative that still exists. It's managed under them. And also building comprehensive capability in health informatics and data science. We've recently created the Clinical Data Science Unit, which is building the capacity to extract valuable existing data through our NHS systems. So that's a real feather in our cap to have that going forward with artificial intelligence initiatives and studies that are mushrooming all over the place. Developing the next generation NHS researchers and increasing capacity. It's very much our interest to expand the capability of potential researchers, clinicians, training them, and again, there's lots of focus on this nationally and funding that's becoming available to enable that to happen as well. Establishing a vibrant innovation campus around City Labs. If you're not aware of the MFT campus surrounding the hospitals or alongside the hospitals, there's a group of City Lab buildings which is encouraging industry and small to medium enterprise businesses to move into the campus so that they're adjacent to the patient population and the research infrastructure that they can work with. And we've already seen successes with the City Labs 1, and we've got 2, 3 and 4 all in the process of either being built or in planning. Next slide. So this is the innovation team. Catherine Boylan reports into Ian, and it's a very small team. And you may remember an organisation called TrustTech, and that still exists and serves the Northwest, and probably larger than that actually, for NHS innovation and advice, intellectual property exploitation. And this is the team that we've created just purely to support MFT. And also you'll find that the University of Manchester has their own innovation team, and we work together when there are intellectual property co-created across the campus. But these are the people that you would contact in the innovation team. And the next slide shows their projects that they're working on currently, and there you'll see the CDSU, the DETA, in terms of strategic funding programs, and innovation adoption, as well as commercialisation and partnerships. So just moving back to the research and innovation managers, next slide. The time point that you are likely to want support or to talk to research and innovation managers is basically at the translation pathways shown there at patient level. You'll either want patient samples to enable you to do your lab research, or you actually want to trial different therapies or treatments with patients. So we're quite far down the pathway, and obviously you've got your BRC that is working with researchers in the university. It's clinical academics that work across both the university and the trust. But this very clearly describes where we would come in that process. Next slide. So what do R&I managers do? We shorten their name to RAMES, if you hear that bandied about. The main responsibility is similar to the research support managers in the university in budgetary sense, that when you're creating grant applications, the research and innovation managers, RAMES, have budgetary responsibility, and they have groups of people working across all the specialty areas underneath them. So in the past, they had responsibility just purely for a hospital portfolio of research. They're now actually restructured so that looking after specialties across all the 10 hospitals. So if you want somebody to support you with diabetes, you go to the RAME that covers diabetes, and that would enable them to support and advise across Wythenshawe hospitals, North Manchester Hospital, and MRI if it's adults. The only dedicated RAMs per hospital are the St Mary's Hospital and the Children's Hospital. And Kate Barugh is a St Mary's RAME. She was going to present today, but there is a strategic meeting with the St Mary's at the same time, so she's gone to that. And Helen Blackburn is the Children's Hospital RAME, and the rest of the RAMEs, the other 4, are spread across all the specialties across all the hospitals. So they support grant applications and help with enabling other outputs from research so that we can communicate our research successfully through communication channels. And they also line manage all the non-clinical research delivery staff. As you saw on the previous structure, there's a nursing infrastructure as well, and matrons that manage those staff. So we're very closely linked. The RAMs are aligned with matrons in terms of staff management. They also conduct risk assessments and performance manage. So this is where they change from being a research support manager type role into governance and oversight, and generally troubleshooting any problems that might come up in the delivery of the research with patients across campus, financial or otherwise. There's lots of training involved, and liaison with the hospitals that they're working with, the associate medical directors for research that we've appointed across the trust, and liaison with industry as well, so or other partners, non-commercial partners that we want to collaborate with. And also collaborating with the innovation team to help support the protection and exploitation of innovations, just ultimately to improve the delivery of the care that we give to patients. Next slide. So just focusing a little bit more on the costings, you'll find that people that don't work in the NHS don't understand what costs are relevant. And if you're preparing a grant application for a funding body that doesn't necessarily, if you're leading on the grant application from the university's perspective, the one main point is highlighted there, that what we're trying to achieve when we're costing is to make sure that NHS budgets are not paying for research. And that's the underlying principle, really. So this sentence you'll find in paperwork, national paperwork that's come through from the Department of Health and NIHR, is making sure that we quantify and fund the full cost of research, because it's seen as a different purse that comes through, a different channel to pay for research. It's not core business for the NHS in that sense. So the RAMs are responsible for making sure these costs are covered, and they do this with the help of the teams that they have working for them and the clinicians. And this is essential to be able to confirm that we have the capacity and the means to run the study. So it sounds very logical. So many types of research that are conducted are outside what is deemed standard care in the NHS. So most of what you do in research pretty much should cost something. Next slide. So I'm going to introduce Jo, because we've only got the 15 minutes, so we can't cover everything that everybody does, and it's very diverse roles, research and innovation managers. And Jo is essential to support the NIHR grants, and she works so closely with the RAMs to ensure that all grants across the trust are supported. And I'll stop there and allow Jo to step in at this point and continue with her presentation. Thank you.
Thanks very much, Alison. So my name's Jo Bryant. I'm the NIHR Grants Research Assistant. I provide specialist support for all NIHR grant applications across the Trust. It gives me a kind of bird's eye view of what's going on in the Trust at any given time. The NIHR is one of the more popular funding routes for the Trust. And so part of that role includes reviewing proposals and looking at what the possible costing implications are, checking eligibility and call-specific deadlines. The NIHR are known for changing deadlines without necessarily making a fanfare about it, and having very, very long guidance documents. So I kind of provide a almost signposting service and making sure that people are aware of the kind of eligibility criteria and the guidelines. I coordinate the costings, and I've mentioned the Surrey Cat there. I'm going to be doing a slide about that later on. I also signpost to internal and external collaborators or stakeholders. So if it's a mixture of trust and university staff, I'll of course liaise with the research support managers and officers at the university here in Manchester, but also at different trusts and universities across the country. So I kind of build those relationships with people and make sure the costings are sorted out in time. Coordinating deadlines, we'll see in a couple of slides time about how much we actually need to manage in the course of a call and what we need to sort out before a deadline arrives. So I'll talk about that later, as well as facilitating institutional signatures. Generally, I'll collate together applications that require signatures and make sure that everything's in place for those. But I'll also do some kind of more proactive, maybe some more strategic stuff. So I provide deadline updates on a monthly basis for NIHR calls. So if anyone's interested in that, you can contact me and I provide those monthly updates. I also do call matching. So if people have ideas or proposals that they want to kind of move forward and they're not sure which NIHR call they want to go to, then of course that's an option as well. Streamline processes, so workflows, checklists, work instructions to make sure that we can provide an effective, efficient service, especially given how deadline oriented it is. And then also training and outreach. So sessions like this, but also providing support to clinical trials coordinators or managers who are involved in grant applications as well. I'm conscious that time is short, so I'll make this very much a whistle stop tour. So we've recently updated flowcharts on what's involved in the grant applications process. These are available on the MFT intranet, but if you're not MFT staff, you won't be able to access this. So again, please feel free to contact me and I'm happy to send you those flowcharts. So at the moment, we've just got a flowchart for fellowships and also for project grants. So I'll give you an example in the next slide, but before that I just wanted to highlight the fact that we've been collaborating with the NIHR Northwest RDS. So we've spoken quite a lot with Andy Vale, and he's helped us out with our successful NIHR grants writing workshop, which is the next edition of which is coming up on June the 10th. So the Eventbrite link can be seen at the bottom here, and you can click on it through the slides. So don't worry about reading all of this now. It's just to give you a kind of indication of what the flowchart looks like, what kind of deadlines we're working towards, and why we have these kind of deadlines. Why do we ask people to come to us 8 to 10 weeks in advance? So hopefully that will give a bit more of a flavour as to why we need so much notice. So key points from that, so approach us early, at least 8 to 10 weeks. All clinical trials must be reviewed by our Sponsorship and Governance Oversight Committee, or SAGO. And so this requires planning and careful deadline management. Notifying us of signatories or letters of support that are required. This is often senior people in the trust, senior management. So we need to make sure that this is on their radar as early as possible, so we don't rush around at the last minute. Most grants are 2-stage if it's NIHR, so we prefer to make sure everything's in place at stage 1, such as the detailed costings and Surrey Cat, so that it minimises hassle at stage 2. Research for patient benefit grants must be mask peer reviewed, so that's something that's really important in the internal deadline process. There's so much information about the Surrey Cat. I won't go into the detail about it now, but it's basically a tool that we use to attribute costs and determine whether it's a treatment cost, a service support cost, or a research cost. And it's usually submitted at stage 2 for validation by an accord specialist, but we complete it at stage 1. So I'll leave the information there and people can look at the slides at a later point. And I'm just going to leave you with a few very quick top tips. So again, 8 to 10 weeks in advance. That applies regardless of the funder. You know, if any NHS involvement is likely in your grant, please do approach us at the earliest possible stage, because as Alison said, everything does have a cost. Pay careful attention to eligibility and funding limits. It does vary between the NIHR and research councils. So if you need advice, contact us. Keep us in the loop, keep communicating, come to us early, even if you're resubmitting. That's really important. And 2 very important things that tend to get overlooked: PPIE and equality, diversity and inclusion. We have the vocal team who provide specialist PPIE support, but also EDI, equality, diversity, inclusion is really, really important. The NIHR do feedback on it. So I recommend that you read up on the links that we have put on the slides. So if there's anything we're not sure about, I'm aware this was a whistle-stop tour, so thank you for bearing with me on that, but please feel free to ask. These are our contact details, and Alison will send a full list of the RAIMs and the specialities they cover later on. Thank you.